Hello and welcome to Rajya Sabha Television. You're watching The Big Picture with me, Frank Razam Pereira. India currently has over 140 confirmed cases of COVID-19. The government has been quick to adopt a multi-pronged strategy, including issuance of clear guidelines to ministries for coordinated action, imposition of travel restrictions, suspension of visas, large-scale screening and contact tracing, as well as regular dissemination of information to the public. Mounting a swift response involving all stakeholders in a country of India's scale and diversity is undoubtedly commendable. With these measures in place, we can be confident that India will be able to successfully limit the spread of the disease. Meanwhile, in Italy, the number of coronavirus cases and deaths continue to surge. Doctors and nurses are under increasing pressure and are calling out for help while medical supplies run out rapidly. In the US, dozens of healthcare workers have fallen ill with COVID-19 and more are quarantined after exposure to the virus, an expected but worrisome development as the US health system braces for a surge in infections. The need of the hour is to build a resilient public health system that can prevent diseases, promote good health and respond quickly to minimize loss of life when faced with an outbreak of this magnitude. On this edition of The Big Picture, we will analyze the role of a robust public health system in dealing with a pandemic. Joining me on the program today are Rajiv Das Gupta, Professor, Center of Social Medicine and Community Health, JNU, Aditi Tandon, Special Correspondent of the Tribune, and Tanzin Dikid, Joint Director, National Center for Disease Control. Thank you to all my guests for joining me on this edition of The Big Picture. All right, let me begin the program with Aditi. We'll start with you first, of course. Is COVID-19 threatening our public health system?
See, COVID-19 is, as we all know, a new strain of the coronavirus, and the knowledge regarding this particular strain is very limited. The entire world is currently undertaking a host of researches to find out what kind of a vaccine or a drug will work against this virus. The primary problem with this particular virus is that we do not know that there is a cure. We only can manage the disease. Management puts immense pressure on the public health system, precisely because you have to test the population. After testing, if the population is presenting symptoms, you have to then isolate them. And as we know, the virus itself has an incubation period of 14 days. And in very few cases in China, we have actually seen that the virus is returning in some cases, even after 28 days of quarantine and after people have been discharged. So there are a multiple range of challenges on this particular front. In India, as you earlier mentioned in your opening remarks, the government was smart enough to quickly close down borders, to impose travel restrictions. Advisories to states, if I remember correctly, went as long back as on 17th of January, when even the World Health Organization had not declared coronavirus epidemic as a international emergency of public health concern. So India acted very fast, did not even wait for WHO to actually make that kind of a pronouncement, and we started putting in our systems in place. But as you know, we are a huge country. Our public health expenditure on health is low. The facilities and infrastructure in the public hospitals is also right now extremely strained, because as you said, there are active cases are only about 130. About 10 cases have been discharged and there are 3 deaths. But yes, total positive caseload for the country is the one that you mentioned, around 147, out of which there are around 25 to 26 foreign nationals. And India has also done amazingly well in taking care of the foreign nationals. We are taking care of Italian infected people on the same footing as we are taking care of our own people. And that is exactly the expectation of India from other countries where currently some Indians are stranded and have tested positive. For instance, in Iran and some in Italy also. But yes, I do agree that the public health infrastructure, although it's responding well, if we do graduate from stage 2 of the transmission at which we are currently, which means that we only have imported infections in India, plus infections which people have caught by getting in touch with these people who have brought the infection from
direct
outside.
Contact.
Yeah, direct contact. We haven't yet progressed to the 3rd stage, which means community transmission, which is a real challenge for a country like India, because we are a hugely populated country with a very dense population.
Sure.
So that will be a challenge.
Sure. Okay. Rajiv Das Gupta, let's talk about this 3rd stage that Aditi is talking about now. if at all we get into that, and it looks like we may, looking at how we've seen the virus, spread in other countries, be it Italy, US, South Korea, any of these other European countries as well. Is our public healthcare system ready to meet the challenge?
The extent to which it's happening in Italy and Spain, that's really a very, very challenging situation as far as India's system goes. As we speak, Bangalore and Mumbai are considering, or in fact have declared lockdowns of public spaces with, of course, some reasonable relaxations for grocery shops, pharmacies, etc. Not the kind of situation that France or Spain is in, where they have had to call in armed forces. That's, of course, we hope we don't get there. But even if reasonable community transmission begins, for the big towns or the cities, India will probably manage to some extent. The rural hinterland, we still don't know how much of the demand will be there. But my guess is that these hotspots will begin to emerge, and it is how these individual, the extent to which these individual hotspots are resilient. So Mumbai may be a much more stronger, in much more stronger position, whereas a district in Maharashtra, if it emerges as a hotspot, will have its own challenges. The other key issue for the Indian condition really is the extent and the nature to which the government will be able to rope in and work with the private sector. And high-end tertiary care, which is really the challenge here and which is something we see Italy is facing, that really is the big challenge. That's extremely expensive. For patients, that's going to be long drawn. To what extent the government will be able to leverage on schemes like Ayushman Bharat, to what extent the government will be able to garner support from private partners is actually going to turn out very crucial once the number of clinical cases increase. As far as maintaining surveillance, maintaining containment, etc. is concerned, the urban areas will have certain advantages of connectivity, electronic access and so on, but it will also have challenges of relatively less frontline health workers, which is relatively better certainly in rural areas. So there are these various mix of factors, and it all depends how each individual local health authority will be able to play to its advantage.
Absolutely. All right. So, Tanzan Dickett, let me bring you to the picture now. And the next obvious question, of course, is what is the status of our public health system in the country?
So at present, we have a very strong surveillance system in our country, which is called the Integrated Disease Surveillance Program. And this surveillance system is now spread out to more than 700 districts across our country. And we have reports coming from all the PHCs in these 700 districts. So as far as detection of cases is concerned, I think we should be rest assured that if there is any clustering going on in the community, we will be able to detect it early. And also we have rapid response teams in all our 700 districts. So early detection of clusters and response, I think we are in a good place right now.
Okay, all right, taking the discussion forward then. Aditi, what has been done in the recent past so as to strengthen our PHS?
The public health
system, yeah, absolutely. The infrastructure schemes, stuff like Ayushman Bharat, and even if you look at some of the cleanliness drives that we've undertaken, it's it adds to all of this.
I'd agree with the Joint Director NCDC that India's public health infrastructure on the front of epidemics has been very strong, because we have repeatedly faced a number of such infections. For instance, in recent history, we faced the swine flu epidemic, and we remember that in 2015, every time we face a challenging situation on the public health front, we try and improve. For instance, the integrated disease surveillance network has only strengthened over the years, and now, as she says, it has actually reached 700 districts, which is absolutely 100% coverage. That was not the case 5-7 years earlier. So now you see the Indian Council of Medical Research, which is the apex medical research body of India, they immediately acted to create a testing capacity in India, which is currently underutilized. So you see, we did not wait for our caseload to increase to enhance our testing capacity. It is about preparedness. How well is the country responding? The idea behind tough restrictions that the government has placed, for instance, we were among the first countries to close down our borders with China. Then South Korea, Japan, Singapore started screening of passengers very early, set up quarantine facilities very early for the evacuees who came from Wuhan, and also from the Japanese Diamond cruise ship. So all these systems were put in place, and the testing capacity, which is the backbone, important backbone of the entire public health response, is your detection capacity. Unless you know who is suffering, you are not able to either save them or prevent further transmission. So you began with 52 ICMR labs, with the National Institute of Virology being the mother lab, the apex lab, which is doing all the confirmatory tests, and now that system is being expanded. Yesterday we had a very important press briefing by ICMR Director General, Secretary Health Research, Mr. Balram Bhargav, who said that 49 additional labs will be constructed and established within the government system in non-ICMR facilities, which means the government has immediately now roped in DRDO, has roped in CSIR, DBT, Department of Biotechnology. So the entire system of the government has come together to create a response in order to prevent India from transitioning from stage 2 to stage 3. Why did we have these social media advisories? These are a very important pillar of public health response to COVID-19 pandemic, because the idea is to prevent community transmission. You're actually pleading with people to maintain that 1 meter distance, which is so critical. You're asking private employers to consider work from home options for their employees. You're also telling, all the state governments to shut down schools, educational institutions, recreational facilities. Government itself yesterday, through a DOPT, Department of Personnel and Training Advisory, has told all its own employees that if you are in a vulnerable age group, which is if you are already sick with comorbidities, and if you are plus 60, which is the high risk population. If you analyze the people who have died, the 3 people who have died of COVID infections in India are all 60 plus people, and they had other comorbidities, like they had already had cardiac issues, or they had diabetes, they had hypertension. So these risk factors were present. These are the people who have died. So the government has told their older employees who are already suffering to stay at home. Every person right now, the public health infrastructure doesn't operate in a vacuum, Frank. There are 3 levels of response. The first level is the government level, where I think a lot of work has been done. The second is the individual level. You had this very unfortunate video this morning posted by Soni Razdan, of some people shouting at policemen in T3 terminal of Delhi, yeah. Why have you taken our passports? I mean, the whole country is responding to a public health emergency. You can't spare 1 hour in a queue to put your own part, and help the country. The idea is to contain infection, right? You see countries in Europe like Italy, you see so many people coming out in their balconies, singing songs, trying to uplift the morale of public health workers. We are not even talking about the frontline public health workers who are staking everything to save lives.
Absolutely.
So what is our own responsibility in this pandemic?
Sure.
Public health infrastructure is not just a hospital, or it's not the building, it is people. And it is not just people in the government, it's people in the private sector, as he said, plus individuals, that each one of us has to play our part.
Absolutely. And this is an aspect that I want to take forward. Rajiv Dasgupta, how do we help our doctors, nurses and the support staff at a time like this? Because we've heard some horror stories coming out of Italy, even from the US, where the people who are putting their lives on the line and treating patients with COVID-19, there's no fault of theirs. They're just doing their duty at the end of the day and are helping out at a time of need. So how do we support them?
In China, particularly in the earlier stages of the epidemic, several key physicians, nurses and workers in the hospitals have actually died.
Yeah.
The current understanding is that anything up to 20% of the health workforce would go out of commission because they themselves would contract the illness. We are not talking of deaths. That it will essentially be 20% short when at a time that you are facing this very serious rise in the number of cases or demand, so to say. Therefore, if you see I think in the last 24 hours, the government has come out with a statement that it has a plan to be able to support healthcare workers who would need protection, who would need medical care and so on. However, the on-the-ground experience that comes from personal sources or anecdotes is that many institutions are actually not still prepared, including high-end private institutions. Therefore, the regulatory arm of the government really has to kick in to protect, because it's one thing to issue advisories, to issue orders, it's another thing how it gets interpreted and practiced at an individual institutional level. So what we get to hear in media briefings is really what comes from the top. That really is the intent, which is absolutely correct and proper. But when it comes to the individual institutions, which is where doctors, nurses, paramedics, or at the field level where people are going to work, you really have to reach personal protection equipment there. Everyone needs to have it. You need a stockpile at the various stores. So it is a whole complex system, including managing the supply chain, which is actually going to mean the extent to which our healthcare workers are protected. So there's a distance to travel between the advisory or the decision and what's happening at the front lines.
Absolutely. And when you hear stories like this of the 63-year-old doctor who now has COVID-19 because he treated the 76-year-old man in Karnataka's Kalburgi, who was the first, of course, death that we had here in India as a result of COVID-19, your heart goes out to them, and you feel sad for the Chinese doctor who passed away as well, as young as I think 32 years of age. So I think as a community too, we need to be a little more stronger and try and support the entire ecosystem and do whatever it is that we possibly can. All right, so taking the discussion forward, Tanzan, as far as strengthening the public system is concerned, what more do you believe that we need to do?
So I think one of the critical things that we need to do for strengthening the public health system is to increase the investment in public health system. So overall, the expenditure on public health should rise. So, but that is like a long-term thing. But I think in the immediate future, what we need to do is we need to have more epidemiological skill base in the country. So public health workforce, one of the public health workforce is very divergent. It just does not comprise of medical doctors. It comprises of epidemiologists, it comprises of biostatisticians, sociologists. So we need to have a whole gamut of people with these multiple skill sets in our country to be part of this public health workforce. And to that effect, the Government of India has started this India Epidemic Intelligence Service training program. It started in 2012. And so in this training program, the Government of India specifically trains epidemiologists in epidemiology skills. So it's not just knowledge, it's also skills. And currently our EIS officers who are alumni from the EIS program are there in the states. There are more than 60 alumni and they're supporting, I think, 21 states in this COVID response. We also have the current batch of EIS officers. They are also right now in the states and supporting the state of Uttar Pradesh, supporting the state of Maharashtra and Kerala in this COVID response. So I think a short answer to your question is that training, availability of enough public health manpower, diagnostic capabilities, and also infrastructure, public health infrastructure.
And what about medical kits and and all of these because in Italy we've heard so much about the doctors and the system itself running out of medical equipment and medicines. So is that also a concern at some level?
So I would say medicines per se, there is no treatment for this. But I would say the availability of infrastructure in terms of isolation beds, in terms of ventilators, that is going to be a challenge in our country. And so I agree with the co-panelists that 70% of medical care in India is provided by the private sector and only 30% is provided by the government sector. So there has to be a collaboration, integration with the private sector. If we are to go into the third phase, then there will be a surge in the number of cases and the government sector is going to get inundated. So definitely we have to work with the private sector, and like Dr. Das Gupta says, when we are thinking of working with the private sector, we also need to think about having strong regulatory aspects in place so that the ventilatory, the isolation bed and ventilator facilities are not, the price is not jacked up and everybody is able to get the
that's a major concern, and that's something that the government needs to keep a lid on, really, if we need to prepare for stage 3. All right, time to get closing comments from all my guests now with the best way forward, starting first with you. Aditi, as far as what else needs to be done, really, as far as the public health system is concerned?
You see, as far as I'm concerned, Frank, I think it's time for people to do their part. The government is doing what it has to do. Advisories have come in, and of course regulatory structures are in place. For instance, if you compare with the swine flu times, when the private labs were making a killing on testing, 10,000 rupees were being charged. But yesterday ICMR has laid down detailed guidelines before involving private sector laboratories, anticipating a surge of cases. So those regulations are in place, but will people adhere to the social distancing advisory, which expert after expert is now telling us is the only key to prevent transmission into the community? All top experts have suggested you please maintain 1 meter distance. Are we doing it in our own spaces? Have people stopped domestic travel? Non-essential official domestic travel has to be stopped because that's what the advisory says. How disinfected are our public transport systems? Delhi Metro, for instance, is it being routinely disinfected? For instance, I know for a fact that DGCA has ordered every plane to be disinfected every 24 hours.
Yeah.
So you see, these disinfection measures have to come in, and the entire social distancing advisory has to be taken very seriously. People have to remember that this is mandatory. Everybody has to step in order to prevent, India from transiting into stage 3, because if that happens, that will be a huge strain on the public health system.
Absolutely. The responsibility lies in each one of us if we need to put COVID-19 to an end.
And also, why not? Because India has shown leadership across the world. India has founded the Global Coalition, which is supporting the first vaccine trial by the US of COVID-19. Prime Minister Narendra Modi took that very important SARC initiative and set up a solidarity fund. India contributed the first USD 10 million. So if the government can do that much, each one of us can do much more at our own levels.
Absolutely. All right. Rajiv Dasgupta, the best way forward.
The government has done its bit, as Aditi says, and the do's and don'ts are fairly well publicized by now. The stage that we are moving into would actually require transforming from government preparedness to what is called community preparedness. And that's something which communities have, A, both to organize themselves, and B, the state arms, the government arms will also have to support that community preparedness at very local decentralized levels. And it's really the imagination that we bring into community preparedness is what is really going to make it decisive if and when, and I'm happy to be proved wrong if it is not if and when, we move into phase 3.
Absolutely. I think we are all happy to be proved wrong. I mean, we are all expecting it. Let's just hope that it doesn't happen. All right. And Tanzin Dickett, please close the show for us with your concluding remarks with the best way forward, really.
So I agree with both the panelists. I think social responsibility is one of the key factors in containment of this contagion. And this contagion is not the last one that we'll see. So I think the key to fighting all these kind of contagions is preparedness, public health preparedness, investing in public health preparedness, and increasing social awareness. And the third thing would be, I think, using evidence-based decision making. So these are the 3 things.
Okay, all right. On that note, then we'll call it a wrap on this edition of The Big Picture. Thank you to all my guests for joining me on the program and putting things into perspective for us. As I leave, I'd like to inform all our viewers and everyone else once again, be safe, stay at home unless you really have to get out, and together we can fight COVID-19. With that, it's a wrap. See you the next time.